Welcome, everyone, to another episode of Back to Basics. My name is Dr. Vivian Asamoah. I'm an integrative gastroenterologist in Houston, Texas. And every Thursday, we have an amazing guest with us. And today is no exception. You guys are going to be really excited about this conversation. I know a lot of women in our practice have been asking us about natural therapies. And we're going to dive right into our discussion with Dr. Ashley Maltz, who is an integrative family medicine physician or integrative internist, right? Which means she does all of medicine in Austin, Texas. Her practice is called West Holistic Medicine.
Yes.
And thank you. Welcome, Dr. Maltz. Thank you so much for joining us today. Tell our people, our tribe, a little bit about you and your practice.
Yeah. So thanks, Dr. Asamoah, for having me. I never know if I'm saying that right, but I hope I am. And Dr. V, we'll call it, or Dr. A. I am, as you mentioned, an integrative medicine physician. I went through all of med school residency as an internist and actually completed a combined internal and preventive medicine residency in Galveston, Texas, just an hour south of you, at UTMB medical branch. So all of my med school and residency training was there. And then I flew off to the East Coast and spent some time in integrative medicine fellowship that was both clinical and didactic. So part of the Andrew Weil distance fellowship, and eventually became board certified in integrative medicine and internal medicine. And now I've studied quite a bit of functional medicine alongside you. And we have, I love sharing cases with you and learning and growing. So, yeah.
That's awesome.
And now, yeah. So I've been in Austin. Sorry, I forgot to mention, I've been in Austin back again for about 9 years now, and took over West Holistic Medicine at the end of 2021.
That's amazing. So I think, people are always looking for a great internist or someone who's going to provide their care and long-term, right? Long-term. And one of I think the most amazing things there are many amazing things about you, but one of the most amazing things about your practice is, one, you are super well trained in everything that's preventative medicine, right? So you do all the prevention component and making sure people are getting the testing done at the right time. And with that eye of integrative and functional medicine, you're actually taking a very, very early peek at when you notice differences. Like, that slight difference that your regular doctor may say is fine, but you really have a very keen eye on monitoring that before it becomes something that's problematic. So that combination of preventative medicine and also that integrative functional medicine component just kind of like makes you like the perfect internist for an adult. Like, so you see mostly adults. You see any kids?
I do see like teenagers. I'll see them not for primary care though, because that's out of my scope of training, and can't keep up with all the schedules of things that need to be done. So yeah, I see about 16 and up.
Okay.
I've seen them for various reasons of like chronic pain or a second opinion on things. It's not usually me just managing, just on my own. But yeah, I see pretty much anyone else. I don't deliver babies, and I definitely am cautious with pregnant women because that's also a bit out of my training scope. But perimenopausal and menopausal women, I see every day.
And that's what we're going to be talking about today, right? It's the perimenopausal, menopausal time. And I think I'm there. I think I'm perimenopausal. I think I am there.
So I have one of my first favorite products or supplements that could help with cycles and sleep and mood disorders from the perimenopausal change is sitting right here because I grabbed it and I have it for myself.
Okay.
So most of the things I recommend to my patients, I actually try on myself first.
I know you do. I know.
Yeah, I mean, I'm constantly trying new things. And it's a funny thing. I joke around and say that supplements come to my house to die because there's just a graveyard of supplements. And, but like I wouldn't recommend anything. Obviously, I'm not going to take anything for a prostate issue or
Right, like something prescribed by.
yeah. Or
Typically.
it doesn't work, it's not gonna do anything in me, perhaps, but I do like to make sure that, it's tried and true for the most part.
That's good. Yeah.
Yeah.
On yourself. Yeah. So when you talked about, we were kind of discussing what topic would be interesting to many people. I was a little bit selfish. And when you mentioned hormonal balance using natural supplements, I was like, right on. I need to hear about that now.
Yeah.
So let's talk about, for those who are listening who may not even know because they're not in the medical field or they're just getting a lot of different opinions. What is perimenopause and when does it start? Does it start like when you stop having your periods or does it start like when does it start, Doc?
So perimenopause can actually be a pretty long process, anywhere from, well, it depends when your body's clock is running, low on its menopause or premenopausal time. And so most women experience it, let's say 40s, mid 40s, or early even 40s to early 50s. And then menopause will hit. Menopause is defined as a 1 year without a cycle. So, but in between, there's a whole lot of years and a whole lot of change. And the one slide that I want to show is some of those. It's a funny rendition of all the different symptoms created by Jolene Bright. She's a naturopathic physician. And I just thought it was the perfect,
I can see. Yeah.
just funny, making fun of it, but also real. These are real things. So same routine, new number on the scale. So weight gain, spotting, was that my period, light periods. It's perimenopause bingo, symptom bingo. So there's a space, then there's change night sweats, right? We know about that. Screaming at partner because you're irritable. Is anyone else sweating? Your hot flashes. It's so varied, right? Migraines, insomnia. Maybe you have excessive periods. You're bleeding excessively. That's menorrhagia here. So it literally anything you can think of. Pain with sex. I mean, is that sandpaper? It really affects women. And honestly, there's very little research that was done on perimenopause, especially perimenopause. Maybe menopause has some research. We know hormones can help. And there's a lot of, we've heard about the Women's Health Study for 20 years now. There's all kinds of stuff coming out on hormonal replacement, but nobody talks about this like transition period. So I think it's a really important time. I mean, for me, my cycles are pretty. Oh, I like this one. Trims chin hairs.
Yeah, I like. Did my breasts always touch my belly button? What's going on?
This is, and we just all laugh at this stuff like it's all part of the process, but like there are treatments for this. We don't have to suffer. So that's that part. We could do a menopause bingo night or perimenopausal bingo night.
We should do that.
But the point being, there's a whole lot of gray in this. It could be up to 10 years of changes.
Wow. Okay. Yeah.
Yeah. So it's not a thing. It's a real thing. And women, we need to
be aware and at least acknowledge what the symptoms are, like what could be going on, right? How about,
go ahead.
How about for those patients, for those people who may have had like a partial hysterectomy
Mm,
and they have maybe one ovary in place, you know, and then maybe they had this when they were in like their 30s or late 20s
mhm.
versus those who have a hysterectomy, complete hysterectomy with the ovaries all gone.
Yeah.
When, how do the symptoms occur and evolve over time for those type of people?
So, obviously if you remove the ovaries, you're going into menopause, like right then and there.
Immediately. Yeah.
It's pretty immediate. And I will say women who even have just like tubal ligation, they can nick the blood supply to your ovaries. So it can result in a not unexpected menopause.
Mhm.
And that's in the consent forms. Nobody reads about it. Nobody even talks about it as much. I've just learned this over the years. But
Wow.
most people, if you still have one ovary, you have one ovary and your brain and that whole pathway is still functioning. It's not, you might start to decline gradually, just like anyone else, any other woman, but it might just happen sooner because there's just not a ton of feedback coming back in. So I the first thing I typically recommend for women is progesterone. It's topical or oral, and it's very easy. Most people love it. It helps with sleep,
Mhm.
helps with emotional lability. It's just calming on the brain and calming on the body. Now, some people can't tolerate progesterone. For some, there's this like not an allergy. Well, some have an allergy, but some just it's like an intolerance, like gluten intolerance, or
Right.
you just every time you use it, you just don't feel good. So that can be an issue. I've done a lot or seen a lot of I send all my patients for acupuncture because we
Okay.
have it in my office and it works for the majority. So that's a helpful, option for really just, again, it's like calming the nervous system because this is a change, right? For women and who've had progesterone and estrogen in their body most of their life, it's a major transition. And I wouldn't even have known, but just starting like a low dose estrogen, which all comes from wild yam, by the way. If it's bioidentical, it comes from yam. So it is sort of herbal, I guess you could say,
Yeah,
but
it's natural,
it's
right?
natural. The compounds they're exactly identical to the ones that are created in your body when you're premenopausal. So, just a low dose can kind of take off the edge while you're transitioning. And then there's so many herbs that can help. So anything that have been used for forever before they could make
I'm
estrogen.
writing some notes down. So tell me about that. Well,
Okay.
the pump that you had, I don't think you mentioned the
So
name. Did
this
you mention the name?
I get this through
Wow.
Fullscope. It's just
Okay.
progesterone and it has a little bit of lavender in it. So lavender's nice and calming. But there are other formulations. Quicksilver makes one now. I
Yeah.
don't know. There's at least four. Oftentimes I'm saying they're out of source. They're back ordered. So you kind of have to
Search,
change.
find one that,
But
yeah.
yeah, but this is literally only 20 milligrams of
Oh, progesterone.
bioidentical USP progesterone, which is just a baby dose.
How does that compare to when you're actually prescribing it orally, Dr. Maltz?
Yeah.
What
So
ranges are you using just to give everyone an idea?
yeah, orally, if they're really sensitive, which I have a lot of sensitive patients, I'm a little worried about them reacting. So I start at 50 milligrams. And then I'll go up to, this is perimenopause. And we can use it like cycling. So you can use it days 10 through 25 of your cycle, and then you stop, and then it can help just regulate cycles. So anyone with irregular cycles can do that. But sometimes you need a higher dose to do that. So 100 milligrams, 200 milligrams, and it's very safe. It helps, it's breast protective, uterine protective. Now, ongoing, we do like to check the uterine layer, endometrial lining, just to make sure that it's not overly thickening. But, that's one thing. That's one possibility for women. Women who are, we also are talking, we got to cover the basics like fiber. Are you eating enough fiber, drinking enough water? Is stress managed? Are you eating enough protein? Because during this time, you want to work on muscle development so that your bones and your muscles stay healthy through the elder years. It's huge, right? Like and that also helps with sugar balance and metabolic balance in general. Omega-3s, just are you eating enough sardines and olives and, Mediterranean diet foods,
Rich in
fatty
omegas. Yeah.
avocado, all these things, flaxseed. It's really helpful for inflammation and balancing that. And then, simple, my favorite. I wonder if this is your favorite or mineral, magnesium.
Oh,
And
that
it's just great. So and eliminating things like alcohol or lowering, at least most women at this stage are saying like, I don't feel well when I drink alcohol, like even one drink and I just don't feel well. So at least my patients and my friends, I don't know. Austin is a bit of a bubble. So I don't
know if that's happening in the rest of in Houston, trust me, they feel okay. They be
They
drinking.
feel okay, yeah. Well, so lowering that amount, alcohol is by definition, it's a poison. It's also a sugar. It's not, we don't need it to survive. Well, some people do, but there are other ways to decrease your stress and, that are healthier. So, working on that, cutting back on sugar, same thing. Caffeine, processed foods, all those things can be really helpful. So, and making sure you're getting enough sleep. Are you even, because one of the things that goes out of whack first is sleep for menopausal women.
For menopausal women, yeah. Yeah.
Yeah.
And that's one of the things that I really believe that these natural hormone regulators help with, right? So starting to use them even earlier instead of waiting for things to get totally out of whack, out of control, and then, trying to find the highest doses. So you said a ton of stuff. So I just want to make sure that everyone listening remembers, right? In terms of natural things you can do. I think Dr. Maltz actually started off with check yourself in terms of your diet, avoid processed foods, make sure you're not putting more toxins into your body, right? Like alcohol, excess sugar, make sure you're getting enough fiber in, make sure you're eating foods rich in omegas, right? She mentioned sardines, olives, avocados, make sure that holistic component is really, that foundation is there. And then in terms of supplements, magnesium glycinate, wonderful at bedtime. And, if you may need an omega supplement, maybe you just don't eat enough omega rich food. So the supplement would be helpful. And then looking at natural hormone balance products, like we just mentioned, the progesterone comes from yam. And this is by now. And I'm sure there are other, looking through full scripts, good companies. Be careful about what you buy online, because like on Amazon, because you really want very clean products, right? Where you're going to be getting this active ingredient at a good dose in your system. So this is
big things for this one is it's USP. You can't see it, but it is USP certified, which means that it's basically an oversight committee that
like a third
is
party
making sure that that's on the level. Yeah, like third-party testing. And this has no artificial fragrances or parabens or anything. So I like that about this one.
When people, Dr. Maltz, when people react, you said some people have like an intolerance or sensitivity to progesterone. What are some of the symptoms they come back to you with, so that people can realize whether it's it's the cream or something else?
A lot of at too high of a dose, it can make your breasts tender. I mean, it's going to resemble symptoms of pregnancy. So progesterone is the pregnancy hormone. So anything that's like bloating, weight gain, You can have like headaches or brain fog. A lot of women are just like, it makes me too sleepy. And it is supposed to make you sleepy. That's why we say to use it at night. But sometimes it's just the dose is too high. So I'll just back down on the dose, and you might have to have it compounded. So that, insurance doesn't cover that, but it could still be a lifesaver. There are a few other really great ones that I recommend for sleep. And so there used to be this blend called Remifemin Good Night. Remifemin, that's the brand name, and it's clinically tested. So that's why we used to use it in my fellowship quite a lot. But they made a product with black cohosh. So black cohosh is the basic Remifemin and that ingredient. And that is used for hot flashes, usually vasomotor symptoms. It can regulate your temperature a bit more, and it's just mood alter. It just feels good. So they used to combine it with hops, which is actually found in beer, but we don't want to do the beer thing, and valerian, which is so calming, and you can get that separately, just regularly. So it was in a great product, but for some reason they discontinued it. I don't know what happened, but I don't see it on the market anymore. So oftentimes
Can you find just pure black cohosh on the market? You can,
yeah.
right? I wonder why that brand was just discontinued, right?
So the brand Remifemin is still continues. It's just this good night formula that they discontinued, and I was prescribing it left and right.
Okay.
For, so maybe I'm the only one who was doing that. So I don't know, but that is a possibility, and it's very well tolerated. I really never had anyone tell me, oh, I'm reacting badly, and it works. So I maybe they'll hear this podcast and bring it back. Yeah, but we can put together, so you can get valerian tea, valerian root. And I don't have the dosing on all of that because it was in a proprietary blend, but and I'm blanking on what the exact dosing, but you can replicate things.
That's good. Okay, so we talked about the progesterone, we talked about other options like black cohosh and something you said for the sleep, but they don't make that anymore. Anything else?
Oh, so many things. Soy does help, and I know from a GI perspective, soy can be very reactive for a lot of people, but eating a plant-based diet / bringing in tofu, and you can even just buy soy isoflavones and get them. Maybe you make sure it's organic and non-GMO and all that. So that has been shown to be quite effective. And that's more for just general menopausal symptoms. Then there's maca, which can help with libido, which all of us probably need a boost. At this age, we're not looking to make babies.
No.
You're like, we're done. But it can really, it's like a vitalizing. I think of, vitality when I think of maca. And that can be in a powder or capsule form. 500 milligrams, I think, is twice a day is a good dose. What else? Vitex chasteberry, which was used by monks in France originally, or somewhere in Europe, and called chasteberry because it made them chaste. It decreased their sex drive because it decreases prolactin, and that increases your estrogen and progesterone. So they did not feel this
urge
as much.
Okay.
And that is very helpful. And that actually grows wild here in Austin. I used to have a Vitex tree right in my front yard, in my old house. You'd have to know how to prepare it and all that, but it's really safe. pretty mild and can help with hot flashes, anxiety, all that kind of fun stuff. So
Mm.
yeah, there's a lot out there. Herbal medicine has been around a lot longer than our synthetics, and I think there's a lot of wisdom to listening to people who know the natural remedies,
And
possibilities.
yeah, and are trying to, and have used it for many years, right? In many
Yeah.
cultures,
Yeah.
and it's worked, right? And so
Yeah,
why not
like
that first?
acupuncture, Chinese medicine. Oh, so Chinese medicine has remedies, and then Ayurveda has remedies. So from India, I think Shatavari is one, and that's a different. I don't know their herbs that well, but um, this is just things I've picked up along the way. And in Chinese medicine, they use a lot of dong quai,
Mhm.
uh, which has estrogenic effects. So we don't want that with breast cancer patient or cancer hormonally based cancer patients. So there's a lot of wisdom. There's essential oils. There's I mean, just stress, relaxation, massage, meditation, vagus nerve stimulation, which I was
Calming
doing.
down that vagus nerve, like you said, is all part of it, right? Mm.
Yep, aerobic exercise and weights are
Mm.
helpful. Finding joy, being in loving, caring relationships and community. So these are kind of just general tenets, but they go a long way
Yeah.
with.
And yeah, it goes a long way. And it's important that, a physician like you is having some of these conversations with your friends, your family, your patients, because I don't hear this from my gynecologist. She doesn't talk to me about this. She,
Yeah,
have you done your pap smear? And let's check
well,
you.
that's important too. That's important too. But there's
Ask me
I'm
about other symptoms.
yeah, I'm really lucky. And then there's also urinary incontinence, which is a whole nother podcast, I would think. I mean, that's not my area of expertise, but there are things you can do that are natural and are not surgical. So, based on the level of, instability there and what's prolapsing, if anything.
It's wonderful to know that there are options out there and that there are natural and safe options that you can start with. But of course, getting the education from someone like you who has experience with your patients, who also has tested a lot of this on herself and can vouch and say, this is good, this is not great quality, or this doesn't work as well, is really, really helpful. Now, I know your practice is virtual, right? A component of it, part of it is virtual.
Part of it, yeah, but I'm mostly in person, actually. Yeah.
Mostly in person
Yeah.
now? Okay.
Mhm.
So,
Downtown in Austin.
so most patients have to see you in person first before
Mm,
you.
not necessarily. No, if they're out of town, we obviously, we try to work with people, but the I see patients in Houston or Dallas or wherever they are. And then hopefully we try to get them in for a once a year visit so I can put my hands on them. But
In person, yes. Okay, so you can actually examine and do whatever
yeah,
you need to do. Okay.
yeah,
And I know that your practice is definitely thriving, but also you're growing lots of different, it's very multidisciplinary, right? You have different, it's not
Mhm.
just, you've got a really wonderful team there. Can you share a little
Yeah,
more so people get a
sure.
good, yeah?
Yeah. So first of all, we have the other physician, Dr. Julia Afridi, who's actually a DO, doctor of osteopathy, and who does hands-on manual manipulation, osteopathic manual manipulation. It's called OMM or OMT, and that can be really helpful. She also is very, very well versed in functional and integrative medicine. So, has a master's in nutrition. Like she's just great. And then sees kids through elder. She's family medicine. Then we have our acupuncturist who's full time, and she's newer to our practice. She started in January and took over from our old acupuncturist, and as he moved to Oregon. But Danielle's great. She's really gentle and nurturing and I think, what a lot of people need. A lot of people don't get that kind of loving care and touch, and she uses the whole modality of Chinese medicine. So it's not just acupuncture, it's herbs, it's gua sha, which is scraping of the skin to allow the blood to come up and heal. It's cupping, it's moxibustion, which is burning of a mugwort over acupressure points. It's all kinds of things. She also does aromatherapy on points, so she's really well versed in essential oils and all that. And then we have our new health coach, who's Darby Carter, who also she's been doing health coaching and a bit of she calls herself the anti-inflammatory coach. She healed herself, or healed from lupus, and so now she teaches, pays it forward, and so she's really amazing. She also uses emotional freedom technique, EFT tapping, to help break through limiting beliefs. So it's a team. It's a team we have.
It's like a wonderful team.
Yeah, I mean, there's no one way to do any of this.
To heal the body, right? There's no one way.
Yeah. What resonates with one person may not resonate with the next. And I love having the possibility of various different, sometimes you need all of them happening, all of this to really make change in your life. And, like, we all have habits that may not be the healthiest. And sometimes there's a belief in there that created the habit. So it be really working on getting into that and living our full embodied selves is what we're aiming for.
Wow. I already feel just so relaxed talking to you. I'm like, boy, would I love if she was my primary care. I'd just go see her all the time.
Oh, well, I'd love you to be my GI doc.
Right? So many facts. This is the kind of physician you need, guys. Really, someone who's looking at that whole picture, right?
Yeah.
And really able to get in tune with you, not just the physical, but also the spiritual, right? That spirit side that's really a part of us, the mind and the spirit, so important. It's been so nice talking to you, and thanks for sharing all these wonderful tips, natural ways to ease into menopause.
Yeah. It's a spectrum, like any, in a transition time. So yeah.
Of this. I'm going to make sure we post everything about West Holistic Medicine so people know where to find you, especially those who are watching this maybe from Austin, or who live in Austin, or who have family in Austin. And we'd love to have you on again. Any words of wisdom before we part ways?
Let's see, words of wisdom. Listen to yourself. That's my word, the words of wisdom. Don't let anyone else tell you that there's nothing wrong, or, that you're crazy, because you're not, for the most part. When it comes to your body, let's say that.
When it comes to your body, when it comes to other things, you may need to listen to somebody else.
Well, balanced view, but really truly listen internally and pay attention.
Pay attention, listen to your body, take it seriously, and try and get answers, right? Try and always get some answers. Yeah. Awesome. Dr. Maltz, it's been a pleasure talking to you. For everyone listening, I'm Dr. Vivian Asamoah. I'm an integrative gastroenterologist here in Houston, Texas. And thanks for joining us today. Bye.
Thank you.